Anneliese of the Health Hub Times Square in Ballincollig joining me. Good afternoon, Anneliese.
Good afternoon, Patricia.
And you are very welcome to the programme. Let me go straight in with a question that came in earlier today. Somebody said, could you ask Anneliese, please, I've recently been diagnosed with rheumatoid arthritis. I don't really know a lot about it, just coming to terms with it all. What would you recommend? What's best to take?
So rheumatoid arthritis is different from the wear and tear arthritis, because it's where the body actually starts to attack the cartilage in the joints. So your own immune system has gone rogue, and the cells, the T cells, start attacking the cartilage in the joint, and that's what's actually causing the wear and the tear, rather than just old age and exercise, etc. So when you're looking at the natural approach for managing rheumatoid arthritis, the first thing to do is to try and look at, see, are there any drivers that would be driving the immune system to be, to have started attacking itself. And in my experience, an awful lot of people who have autoimmune diseases like rheumatoid arthritis or lupus or ankylosing spondylitis or any of those ones, they often have IBS as well. So it's like the immune system in the gut has been mounting an immune response to harmless foods maybe for quite a while, and then for some reason then it just starts being oversensitive and maybe trips over into that autoimmune side where it starts attacking itself. So I'd say, Patricia, maybe 3 in 4 people who come to me with rheumatoid arthritis have IBS. So that would be a big factor in kind of sorting out the drivers. I'd also see a lot of people who've worked around chemicals with autoimmune disease. So a lot of farmers maybe that have been spraying, or people who work in factories where they're using chemicals. Hairdressers as well, it's quite common. It'd be an interesting study to do actually to see what type of hairdressers, how many of them end up with autoimmune diseases. So if you remove the drivers, like you're looking at possibly trying to figure out, are there any allergies, are there any heavy metal toxicities, and then you use foods that support the gut and then that rebalance the immune system. So specifically the ones for the immune system that are the brilliant and off-the-counter would be the omega-3 fats. You just get a very high dose of those, and you're looking for ones that have a very high amount of EPA. So fish oils have both EPA and DHA. They're 2 different types of fat. And the EPA is better as an anti-inflammatory, and the DHA is better for the fatty tissue of the brain. So if you want something to protect your brain, go for one that's higher in DHA, and otherwise for inflammation, one that's high in EPA. And then natural anti-inflammatories like Boswellia, turmeric, bromelain, ginger. These are all fantastic natural anti-inflammatories that can help damp down the inflammatory response in the body.
And can you get it at any age?
Yeah, absolutely, Patricia. And as well, actually, I should mention there's lots of other drivers as well. Sometimes it's triggered by a viral infection. So I think that happened to my brother-in-law. He had a very bad virus, and that triggered a viral infection. And of course, diet and lifestyle have a big part to play as well. So eating a very natural anti-inflammatory diet is a big part of it, whether or not there's any food intolerances. And that's kind of minimal red meat, lots of fish, nuts and seeds, huge amounts of vegetables. Instead of white, go for brown every time, but pack in those vegetables even if you have to juice or soup them, and that really is one of the biggest things I see in terms of people getting a good response to try and get themselves into remission, is cleaning up their diets.
Okay, Phil has noticed that her left shoulder is starting to get sore, particularly if she lifts anything heavy. What would you recommend?
So now there's lots of things that could be, Patricia. Again, it could be your wear and tear arthritis, in which case you're looking at kind of collagen, cartilage. The UC2 cartilage is fantastic for just plain wear and tear arthritis. But it might also be a tendon. So tendons can become stretched and inflamed. There might even be little micro tears or even bigger tears in them. So for tendons, you're looking at things like homeopathic rutagrave, but also things like turmeric and boswellia are as great natural anti-inflammatories. I definitely maybe advise going to see a physiotherapist or a physical therapist to have a look and see can they figure out what's going on. Because if that gets worse, it can lead to frozen shoulder, and then frozen shoulder could take a year to resolve itself. So you want to try and stop that inflammation before it causes those kind of problems.
Okay, Listen wants to know, is carpal tunnel syndrome hereditary? She said her older sister has it and now she's noticing that she's got symptoms.
It can be hereditary, Patricia, I suppose, like everything really is, but I think in many cases, it's massively down to circumstance. So I know one of the big factors for carpal tunnel is repetitive strain injury. So people who would maybe type a lot or work on a computer where they're working on a keyboard, or people who chef, anyone who really uses their hands a lot, it's that type of repetitive strain is a huge factor. But one thing I have to mention and to be wary of, because I thought I had carpal tunnel because of numbness in my fingers, and both my mum and sister had carpal tunnel surgery actually to sort out carpal tunnel. But in actual fact, it came back for them very quickly, and the problem was with a trapped nerve in the neck. So for me, it's my neck always from an old car accident. It's my neck that causes numbness in my hands. So now when I feel it, I know I need to go and get my neck sorted out, as opposed to it being carpal tunnel. So just maybe rule that out first.
Yeah, don't immediately jump in and think just because it's in the family. Yeah, that's a good advice. John has a slightly raised iron count, a little high iron count is how he puts it. What should I take and what foods to avoid?
So the foods to avoid would be the ones that are high in iron, and they would be mostly red meat. Red meat is kind of the most freely accessible iron for us. We do get a lot of iron in things like molasses, green leafy vegetables. You'll get some iron in grains and nuts and seeds, smaller amounts as well. But that's not as available for our system. So it's the red meat really that you need to be careful of. But with high iron, elevated iron, if it's not diet related, it's mostly something hereditary called hemochromatosis, and he might be in the very early, milder stages of it. But over a long period of time, hemochromatosis and elevated levels of iron in the blood will actually drive high levels of inflammation. So it can cause a lot of joint pain, and it might even increase your risk of heart disease and plaque buildup. And the key to actually managing that genetic condition is just to give blood, or to be bled by your doctor every so often, and that massively reduces the iron in your system very, very quickly, and is the most effective management of it.
Could Anneliese recommend anything for this viral flu that's doing the rounds at the moment, says a listener?
Yeah, well, I think we're probably all very low in vitamin D, because actually we haven't had very nice weather up until now. Now the sun is shining this week, so get yourself out and get your vitamin D. But if you haven't been taking vitamin D for the winter, I'd certainly suggest, as a very basic kind of immune support, take your vitamin C, your vitamin D and your zinc at this time, because there is a flu going around. It's often when we change in season, and actually, Patricia, temperatures have been quite cold up until now, so we're having a late start. Other things then that would be far more effective in the very short term would be things like echinacea. I love the Dr. Claire Mucotone. I know you're a fan as well, Patricia, but I always have a bottle of that at home. And as soon as I feel anything starting, anything, and I mean a sniffle or a head or anything, I start taking that 3 times a day. And really, it nearly 90% of the time wards off everything for me. I haven't even had a cold so far this year, luckily. So if you can't get your hands on the Dr. Claire stuff, get some echinacea and start taking that as instructed on the type of bottle that you buy. And then, of course, Ivy Thyme is another lovely one that's available in every health shop for coughs and colds. And, of course, make yourself drinks with honey, ginger, and put in a little bit of cayenne pepper or chili as well, and that boosts the immune system too.
Okay, a 5-year-old child suffers repeatedly from constipation. Advice, please.
Okay, so in the diet, Patricia, if you've got plenty fibre, and if the child is active, and if they're getting lots of exercise, and if they're drinking plenty water, then you shouldn't have constipation. So either they're intolerant to a food that's causing constipation, or it may be that they've had a lot of medication for something recently, like an antibiotic, and that's disrupted the bacteria in their gut, which is related to constipation. So for a child, the first thing I always recommend is the psyllium husk. Add it into their breakfast cereal or add it into a yogurt. But this is a soluble fibre and it's no side effects. It's perfectly safe. It just helps soften the stool. Because for kids as well, sometimes, Patricia, if it's a painful stool to pass, then it's psychological fear of going is also a factor. So softening the stool is very important with that. And foods that are good to help are kiwis, apples and pears. So stew them, juice them, put them in smoothies, whatever you can do. You could throw the psyllium husk in with that as well and give that to them with their breakfast every single morning. And if that doesn't resolve it, and drinking plenty water, then things like figs, syrup of figs can work well. Possibly giving the child a probiotic and a child gut-friendly digestive enzyme would be another option to try as well. And if none of those work, then you really are looking at a food intolerance. So get the test done and take the foods out that are causing a problem.
Okay, Joanne says she's living in a very stressful house at the moment. She's got a leaving cert and a junior cert student. Tensions are high. What would you recommend for the mammy in this case to keep her from biting her tongue?
Yeah, I think everyone would benefit from the same. Oh, Patricia, I'd say houses across the country.
Yeah, it's nationwide. You're not on your own, Joanne.
Yeah, absolutely. And I mean, kids are putting themselves under phenomenal pressure that, their parents aren't putting them under now. They're putting themselves under. So I think everybody in the family would benefit from something like L-theanine. Maconta do a lovely L-theanine and L-ornithine complex. And the nice thing about this is that it actually does kick in very quickly for focus and calm. So it's brilliant if kids want to study and focus. It's great if they're going into an exam for 2 hours and they need to maintain their focus. And it's also brilliant for quashing the exam nerves. And it's great for mum as well because of just that feeling of calm. So, it's very safe to take up to a number of times a day. And it's also great at night to stop the busy body, busy brain. So that would be definitely the best. And of course, for everybody for stress, in the long term, ashwagandha and the B vitamins are a lovely combo. Stress Vita is a very nice supplement. We have a couple here on special in the shop, actually, Patricia. If people give us a call, we have a lot of exam stuff here. We can help people out.
Okay, and just very finally, this could be tied in with the fact that we've got a competition that we're running with the Irish Heart Foundation, is trying to get everybody to know their blood pressure and to get their blood pressure checked annually. Somebody wants to know, could you ask Anneliese, what is the normal reading for blood pressure? This listener says, mine is reading 146/82. Is that normal? Do you know what the normal reading for?
So I think anything from like 140 is like ideal. I suppose blood pressure is 120/80. 140 is still okay, but starting to move up towards the high. So that would be the intervention phase where if you actually start working on that, you can help. And it's things like do plenty exercise, drink plenty water, don't eat too much salt, but don't eat too little salt, So it's fine to salt your food a little bit, Patricia, I think, but avoid salty foods like nuts and seeds and crisps and processed foods and all the shop bought stuff that's already been cooked is generally very, very high in salt, so try and cook your own food. And then increase the amount of fruit and vegetables in your diet, particularly these ones for blood pressure. Celery, full of potassium. Beetroot, full of something that helps to broaden out the veins and arteries, and that's really almost immediately effective for reducing blood pressure. So eat beetroot or have a beetroot juice every day. Increase the amount of vegetable across the board in your diet, Patricia, because vegetables are full of magnesium and potassium, especially the green leafy vegetable, and they're great. And then supplement-wise, I'm always a fan of the omega-3 fats because they keep the arteries and the veins and the capillaries beautifully flexible. So they're very responsive to kind of increases in blood pressure, and you won't be stressing the heart as much. They keep the blood lovely and thin, and they're also nice natural anti-inflammatories. And then things like magnesium, hawthorn and Q10 are all wonderful for blood pressure and to keep the heart and circulatory system healthy.
Okay, thanks a million, Anneliese. Have a great week, and we'll talk to you next Monday.
Thanks, Patricia.
Thanks a million. That is Anneliese Dressel, and Anneliese will put up the advice on her own website, as heard on the radio this afternoon, healthhubstore.com.